being told that you can cure melasma with one cream or one laser. Let me break it to you. That's not going to happen. Melasma is chronic and it's recurring. And the good news is with the right at-home regimen, you can improve your melasma and maintain your results over time. I'm Dr. Morgana Colombo, board certified dermatologist, founder of Vida Derma, a science-backed skincare line aimed at helping women as they age. And today I'm going to talk about what you can do at home to improve your melasma and to maintain, your melasma in good shape. So melasma is a condition where you develop blotchy brown discoloration, typically on the cheeks, around the mouth, sometimes on the chest, arms. It is caused by sun exposure and heat, and genetics and hormones play a huge role. So that's why women, as they go through perimenopause, menopause, start seeing aggravation of like melasma due to unstable hormones, and it's very common after pregnancy also, or on women on birth control. I often see people in my office wanting the miracle laser for melasma, and I tell them it does not exist unless you want to spend like your face like every month forever. Melasma needs to be first controlled with proper topical regimen. And you can start with an in-home outpatient topical regimen in the beginning. The foundation of melasma care, the number one thing you need to do is use sunscreen religiously. Sun is the biggest trigger of melasma, so sunscreen is critical. But not every sunscreen is the same when it comes to melasma. Melasma tends to respond better to physical blocking, the mineral sunscreens, the zinc titanium based ones. And it responds even better to the tinted zinc sunscreens. Those have iron oxide, which gives extra protection against visible light, which is a huge factor in aggravation of melasma. So in our Vida Derma line, we have two tinted sunscreens, one that has a dewy finish, one that has a more matte finish. We call dewy tint and just regular tint. And they are great. They are zinc oxide only, boosted with antioxidants such as vitamin C, ferulic, and vitamin E. And because they're tinted, they have that iron oxide, which is really critical for protecting you against visible light. Now, let's talk about some at-home ingredients you can look for if you want to start treating your melasma from home. The number one ingredient that I usually will put almost everybody on melasma on is a retinol. If they come to my office, sometimes a prescription retinol. So there are all sorts of different over-the-counter retinols out there. I really like our Vida Derma one. It has the hydroxypinacolone, HPR retinoate, retinol, which is potent like a prescription retinol, but not irritating, which is the key factor. It can be well tolerated by women as they age and have like more sensitivity in their skin. So retinol is key because it promotes exfoliation, which allows you to decrease some of that abnormal pigmentation that happens in the setting of melasma. I typically will tell people to do a retinol every other night, of course, in combination with a moisturizer. The next ingredient that I really love for melasma is azelaic acid. It inhibits tyrosinase, which is an enzyme that creates melanin, which leads to pigmentation. So with that, of course, it's good for melasma, but it's also anti-inflammatory, which inflammation drives melasma. And the other fact about azelaic acid is that it helps rosacea and acne. And a lot of patients with melasma will have a combination of acne, rosacea, and melasma. So it covers all your bases. I typically, in my office, of course, will do a prescription one, but there are some people that are really sensitive and cannot even tolerate the prescription one because it causes burning and stinging. So in that case, an over-the-counter azelaic acid can be an option. Our Vida Derma line has an azelaic acid product that we call the Clarifier, which is very well tolerated, does not irritate, and I typically tell people to use in the morning, followed by your tinted mineral sunscreen. Some of the other ingredients that can be beneficial in melasma are arbutin and kojic acid, which you can easily find in over-the-counter preparations. They, again, inhibit melanin synthesis, which contributes to pigment, so they're good for melasma. In our Vida Derma line, we have our brightener pads that have both kojic acid and arbutin, also a little salicylic acid, vitamin C, all creating this nice anti-pigment effect. I tell people to use the pads every other night, alternating with retinol, always followed by a moisturizer. Some other ingredients to also consider for melasma, they're over the counter, are cysteamine, which inhibits multiple melanin synthesis pathways, so good for melasma, especially stubborn melasma. So cysteamine, that's one ingredient that you can look for in your skincare. You can also look for products with glycolic acid. I would typically recommend a couple times a week a 10% glycolic cleanser. Again, it's an acid that promotes exfoliation and removal of some pigment. And, there are ingredients such as tranexamic acid, licorice, vitamin C. Those all can also be beneficial in the setting of melasma as over-the-counter ingredients. But a typical regimen that I recommend if you're going to just start an over-the-counter regimen would be a glycolic cleanser, 10%, a couple times a week. In the morning, azelaic acid, followed by a tinted mineral sunscreen. At night, alternate between a retinol and some sort of like lightening agent with kojic acid or arbutin. You can also look for cysteamine to do a couple times a week. So that would be a really good over-the-counter regimen to start treating your melasma. If you do that for 3 or 4 months and you're not getting results, then of course, come to our office, a dermatology office, and we can offer you some prescription bleaches or, stronger prescription ingredients of the ones that you're using. And we can always add treatments such as chemical peels, lasers, microneedling with radio frequency to further improve your melasma. As per lasers, everybody always asks which lasers help melasma. Typically, the Pico or Q-switched 785 and 1064 nanometer lasers can be beneficial, or your Clear and Brilliant, which has a 1927 1440 nanometer wavelength, and Fraxel with a lot of caution with the 1927 1550 nanometer wavelengths. Those are the three devices that can be used in the office for melasma, if you're curious. So, I talked about all those topicals that you can use for melasma. The last ingredient that I'm going to talk about that you can use at home is the supplement called Heliocare. So Polypodium leucotomas, or Heliocare is the name, is an oral supplement that blocks UV-related pigment synthesis. It's not to be used instead of a sunscreen, but it's a booster to your sunscreen, makes your sunscreen more effective. It's something that I recommend to a lot of my melasma patients to be used year round if they live in like a sunny place or between spring to fall if they live in a more seasonal kind of weather. Very effective for melasma, and is also used for people that have, sun-related, sun-triggered conditions. So as I went over, there are lots of over-the-counter ingredients that you can try at home to control and maintain your melasma. The key to melasma improvement and maintenance is consistency. You really have to stay on a regimen indefinitely because melasma is chronic, and it comes and goes. Um, so important to have that consistency, especially when it comes to sunscreen. You want to have that tinted mineral sunscreen on every day. If you're going to be out in the sun, you have to reapply that every 2 or 3 hours and still have even more protection, wear a hat and glasses. On top of that, excessive heat is something that you have to be aware of. Melasma gets way, way, way worse when you're exposed to too much heat. So it's not just the sun and heat. And irritation and inflammation drive melasma. So whatever you do for melasma has to be done in a very gentle manner. So keep that in mind. If you follow those recommendations, you will certainly see some improvement in your melasma. Our Vida Derma line has great products. They're gentle and can be a start in your journey to improve and control your melasma. I hope this video was useful to you. If you like more content like this, such as you want to watch maybe some videos about, in-office treatments for melasma, which will come next, please subscribe to my channel.